afternoon. It's Tuesday, February 8th, 2022. It is our 2 o'clock consent agenda meeting. Let the record reflect that all 3 commissioners are present and our executive management team. Just for the record, item 2B will be stricken from today's agenda. Item 2D will be taken separately. Public hearing number 4C, which is in the matter of revising Spokane County Traffic Code number 46.61.5701, no parking Park Beach Road, has been delayed. It is being canceled for today and is being rescheduled for a later date. So that will not be taking place today. So if you are here to listen for that, we will not be having that public hearing today. We do have one by leave item number 5, a resolution in the matter of considering the offer of settlement in Holloway versus Spokane County. And so that is by leave item number 5 today. With that though, before we get started on our consent agenda, there's been a request that from our civil deputy attorney that we go into executive session for 10 minutes to discuss, and Mark, I will let you state the reason.
Thank you, Commissioner. The executive session is for pending litigation. It is the Holloway settlement, the by leave item. So you could go into executive session now or do it at the end of consent agenda. Either is fine. I
think I was requested to do it now.
Okay, that'd be great.
Then we can just take it as all part of the by leave. The by leave is part of the consent agenda.
That will work. And Mr. Evans needs to be brought into that executive session then.
Okay, and you anticipate 10 minutes?
I think I anticipate 15 minutes, but it will be brief, yes.
So, I'm sorry, 10 or 15? 15
minutes, please.
15, okay. So, it is 2:02. We will go into executive session for 15 minutes. It will take us just a couple of minutes to make our switch from one to the other. So, I expect by 2:15 we will back would say 18 to 20 that we will be back in regular session to address the rest of our consent agenda. Thank you, and we will see you back at 2:18 or 2:20. Okay, great. Thank you very much. It is 2:20 and we are back from executive session. Just for the record, in that executive session, it was the 3 commissioners, our executive management team, Casey Evans and Mark McLean from our civil attorney group. So thank you very much for that. And so then I will look to my fellow commissioner for a motion on the consent agenda.
So, Madam Chair, I'm going to make these motions in a series of motions, starting with approving items 1, 2A and 2C, and item 3A and B as presented on today's agenda.
I will second the motion.
Okay, I have a motion and a second to approve item number 1A, 2A and C, 3A and B as presented on today's agenda. Any other discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Aye. Motion passes unanimously.
Then, Madam Chair, my second motion would be to approve item 5, which is a by leave item. And I'm going to ask Attorney Casey Evans to read the motion.
Yes, thank you, Commissioner French. Commissioner French is moving to approve the settlement matter in the federal or United States Bankruptcy Court, cause number 22-8000 or 80001 FCP as presented.
So move.
I will second the motion.
So I have a motion and a second. I will just say it briefly in the matter of considering the offer of settlement in Holloway versus Spokane County et al. Any other discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Aye. Motion passes unanimously. Thank you. So
And
then,
Madam Chair,
yes.
then I would like to make a motion to approve item 2D like in dog in the matter of appointing Dr. Alicia Policani, Public Health, Charlie Durana as community stakeholder, and Christopher Patterson as Public Health consumer to the Spokane Regional Health District Board of Health.
I will second that motion.
I have a motion and a second. Further discussion?
Yes, Madam Chair, I'd like to speak to my motion.
Okay.
So there's been a lot of misinformation and political posturing over the last many months over the creation of the new Health District Board to comply with the legislation adopted last year. Even the legislator that sponsored the bill has criticized us for following the law and not his intent or what was in his mind when he voted for the bill. So I'm going to take a couple minutes to provide some history and context of what is before us today and why I'm voting the way that I am. To begin with, the Health District Board is a community board, not a medical board. This differentiation is critical to this process. The Health District Board provides oversight and community input to the programs and functions of the Health District. The board does not make medical decisions. Those decisions are left to the health officer and his staff. In addition to the health officer, the Health District employs approximately 30 other licensed doctors or certified medical professionals that deal with the day-to-day medical issues of the district. These are the same professionals that have served the community for years, and particularly in these last couple of years as we've navigated through the pandemic. Our response to the pandemic is not a one-person response, but is an organizational response with the input and guidance of staff at the district and medical professionals in the community. I've served on the Health District Board from 2002 to 2009 and 2011 to present. So I'm the longest serving member on the board. From the early 1970s to 2011, the Health District had no doctors on its board. As a county commissioner, I appointed Dr. Lutz to the Health District Board in 2011. With my appointment of Dr. Lutz, he became the first doctor to serve on the Health District Board in over 40 years. A couple of years later, I appointed Andrea Frostad, a dental hygienist, to the board. These were the only two board members with medical backgrounds until Dr. Kinsley was appointed by Commissioner Kearns. While there are those in the community and local media that are accusing the commissioners of trying to manipulate the board and remove medical professionals from it, this assertion is simply not supported by the facts. In the last 50 years, the only medical professionals serving on the Board of Health were appointments from Commissioner Kearns and myself, even though it was not required of us to do so. By way of comparison, the website for Providence, that owns and operates Sacred Heart Medical Center and Holy Family Hospital, has a 15-member board, of which only 2 are licensed doctors. They also have an executive council of 34, of which 5 are doctors. According to the website for Multicare that operates both Deaconess and Valley hospitals, they have a 10-member board and only 1 of them being a licensed doctor. So the Board of Health district is similar to that of the hospital systems in that the community where the doctors do not dominate the membership of the board. In addition to consulting with doctors and staff at the health district, the administrative officer, Amelia Clark, and health officer, Dr. Frank Velasquez, meet with the chief medical officers of the hospital's systems every month to coordinate activities and provide mutual support. There are those in the community that accuse the commissioners of political power grabbing with the restructuring. Again, the facts do not support this accusation. The restructuring of the Health District Board is being done to comply with the new legislation imposed upon the county by the legislature. If this was about consolidating power, then the Board of County Commissioners would simply dissolve the health district and make it a department of the county like many other counties in the state have done. The Health District Board is a community board, not a medical board, plain and simple. It is unfortunate that the drafter of the legislative change did not understand that. Fortunately, the legislature did understand this very basic difference and kept the board as a community board with broad community representation. In composing the new Health District Board, we have reduced the number of elected members and replaced them with community members. Keep in mind that every city is still a part of the county, and the Board of County Commissioners represents the entire county. The appointments we are making today are in complete compliance with the law. If there are those that are unhappy with the law, then talk to your legislator, not us. We're trying to abide by the law. Thank you, Madam Chair, for the opportunity to read my comments into the record.
Yes. Commissioner Kurtz.
Yeah, no, I wanted to make a few remarks as well. Over this last week or so, some of the headlines that we've seen in the media are no medical doctors nominated to fill vacancies in Spokane County, no medical doctors nominated in restructuring of Spokane Health Board, no medical doctors among Spokane County Health Board's nominees. The list goes on and on. I would like to read from the bill as passed by the state legislature. And again, I would like to highlight, as Commissioner French did, that this was a governor's request piece of legislation. And it was prime sponsored by Representative Marcus Riccelli and adopted by the legislature. And I'll read from Section 3 of the bill that says the public healthcare facilities and providers. This category consists of persons practicing or employed in the county who: A, medical ethicists; B, epidemiologists; C, experienced in environmental public health, such as registered sanitarian; D, community health workers; E, holders of master's degrees or higher in public health or the equivalent; F, employees of a hospital located in the county; G, any of the following providers holding an active or retired license in good standing under Title 18 RCW. Now I'm going to list these up: physicians or osteopathic physicians, advanced registered nurse practitioners, physician's assistants or osteopathic physician's assistants, registered nurses, dentists, naturopaths, or pharmacists. So I would like to highlight that we could have appointed a pharmacist, we could have appointed a dentist, we could have appointed a registered nurse, we could have appointed an employee of a hospital located within the county. We could have appointed somebody who works in the accounting department of a hospital. That could have come in handy when we're adopting the budget. We could have adopted an HR director of a hospital. That could help us when we're dealing with contracts or labor issues there. There's a lot of latitude that was given in this bill. And unfortunately, I haven't seen one mention of that in local media coverage on this. We haven't seen anything mentioned of this on social media. There's a lot of anger and misinformation that's out there on this bill. We have three individuals who put themselves forward because they want, that are going to be appointed to this board because they want to make their community a better place. I mean, and it's no wonder that we have so many people, it's no wonder that we have so many boards and commissions that we appoint to that don't get a whole lot of applicants. I mean, if this is what they have to go through, I mean, these three individuals, before even being appointed to this board, have had their names drugged through the mud, called unqualified, people saying that, that they're not qualified, they don't fit the category that they've been appointed to, and that's just false. And it's very disappointing. These are three individuals who have histories of positive contributions through volunteerism in this community, and I'm going to be voting yes to appoint these three individuals. They fit the qualifications, they fit the categories they've been appointed to, and like Commissioner French said, if you're unhappy with how the bill was drafted, which we are following to the T, contact the people that asked for the bill to be introduced, being the governor, and the individual that prime sponsored the bill, being Representative Marcus Riccelli. We are following the guidelines for these bills. And unfortunately, that's one thing that has been missing in this whole discussion, because it has been very politically charged. We continue to be attacked for following a bill to the T that we didn't even want to be adopted. I mean, we were operating just fine under the old structure, but we're not allowed to have that structure anymore. We were one of the only health boards, I think, in the state that had non-electeds on our board prior to the adoption of this bill, and that wasn't good enough. So, I want to compliment everybody that did apply, that put themselves out there to be appointed. It's never easy to put yourself out there, and I want to thank everybody who did apply, everybody that interviewed, and I want to thank the three individuals that are going to be appointed today for the work that they're going to do to make this community a better place.
Thank you, Commissioner Kearns. Commissioner French, you've raised your hand.
Yeah, I also wanted to point out, just for the record, that the reporter that's been most notorious at getting the facts wrong or being lazy about trying to find out the facts is not a participant in this meeting. So I guess the facts are inconvenient for the stories that he continues to perpetuate out there in the community. I just want to state that on the record. Thank you, Madam Chair.
And I guess I just want to state for the record as well, that I appreciate both your comments and agree that this was something that we would not have been making changes to the health board had we not been required to do it. We are doing it just a few months earlier because we have to do it by July. So there was no choice for us in this, that we needed to, uphold the laws of the state of Washington, which we took oaths to, and so we are doing that. But we're just doing it early so we can have those board members on the health district board for, hopefully almost the entire year, versus just having them on for 6 months as we go into, just get them on the board just as we start to go into budget season. So we're trying to be very thoughtful in getting these people in place for the year, because again, we were going to have to do this by July. So we would just be 2 months further down the road and starting this process again. And I do have to say too, there's a lot for these individuals to put their names forward. They're seeing that there's good things and bad things that come of that. They're going to be able to make a contribution to their community, and they're passionate about that. I hope our community will embrace that. They'll reach out and give positive comments because these people really want to do a good job for our community. And everybody that applied, I know that that's their feeling, that they really wanted to do a good job for their community, help make their community better, just like elected officials do. So thank you both for your comments. Anything else? I will call for the vote. We have a motion and a second in the matter of appointing Dr. Alicia Policani, Public Health, Charlie Duranona, Community Stakeholders, Christopher Patterson, Public Health, to the Spokane Regional Health District Board of Health. All those in favor, please signify by saying aye.
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 Motion passes unanimously. Thank you. That will then take us to our 2 items for public hearing. So the first one is item 4A in the matter of revising Spokane County Traffic Code number 46.44.041, remove load limits for Fridger Road Bridge. I'm sorry, I'm messing that name up, Matt. You can help me out. Bridge number 4902. And then we're doing these all as one. Removing load limits for the Wallace Road Bridge, bridge number 5712, and adding load limits to the Anderson Road Bridge number 2310. So with that, I will look to Matt Zuracord for any information that he would like to present.
Thank you, Madam Chair. Good afternoon. And I believe Ron has my slides. All right. Thanks, Ron. So next slide, please. So the first bridge we're going to talk about is Fridger Road Bridge, and that isn't an easy one. And it's down, you can see here on the picture, it's on the Little Spokane River, and this is at the very north end of the county, as you can see on the vicinity map to the left. And next slide, please, Ron. This is a little closer shot of it. This was a new bridge that we built under contract last year. It was completed. And so we got a nice new bridge out there, which removed the need for the weight restrictions. Next slide, please. The next bridge we're going to talk about is the Wallace Road Bridge. This was another new bridge for us. You can see this is up on the side of Mount Spokane off of Elliott Road, and it crosses the South Fork of Dead Man Creek. Next slide, please. And this is a close-up. You can see it's very near the intersection there. This work was completed by county maintenance staff. We have kind of a new process we can do for smaller bridges that's extremely cost-effective for the public. We're kind of excited to be rolling it out. We did one bridge last year and two bridges this year. So it's a good new process for us to get a lot of bridges replaced for not a lot of money. And let's see, they also wanted to note they did a really great job, just for the commissioners' knowledge. When they did this bridge, it was one way in and one way out for the folks that live there. And they were able to leave a portion of the old bridge while they put in a portion of the new bridge, so that they weren't cutting people off from their homes, which is really obviously a great thing. People, oftentimes when it's like this, we have to put people up in hotels and they're inconvenienced. And if they have animals or anything else that needs cared for, it can be real inconvenient. So that was actually, it was thought up by one of the members of our bridge crew. So, you know, kudos to them for thinking outside the box and coming up with a solution for that. Okay, next slide, please. The next bridge is going the other direction. This one we're putting weight restrictions on. So the proverbial 2 steps forward, 1 step back. This is Anderson Road, and you can see on the vicinity map, it's down near Cheney Road. It's actually just off Cheney Spokane Road. Next slide, please. And Anderson Road's a gravel road. After leaving Cheney Spokane, it crosses what used to be 2 sets of tracks going through pretty deep cuts. One of them's been converted to the Fish Lake Trail, the one on the west side, and the eastern one is the UP Southwest. And that's the one that we're having to restrict. And the cause of the restriction is the new loads that are legal are different than the old roads that the old loads that these were originally built for, causing the need for weight restrictions in certain cases. Okay, that's it for this public hearing. So I'll give it back to Commissioner Cooney and see if there's any public testimony or answer any questions the board may have.
We'll see if there's any questions from my fellow commissioners first. Seeing none. Okay, so then I will open up the public hearing for item number 4A in the matter of revising Spokane County Traffic Code number 4644041 for the removal of load limits for the Fridger Road Bridge and remove load limits for the Wallace Road Bridge and add load limits to the Anderson Bridge. So with that, I will now open public testimony. If you want to provide testimony for the public hearing, please utilize the raised hand function or on your screen, or press *9 if you are on the phone, and we can monitor that and see who would like to speak. First call for anyone wishing to testify. Second call for anyone wishing to testify. Seeing no hands raised and not seeing anyone come off mute on their phone. Third and final call for anyone wishing to testify. I will then close the public hearing and look to my fellow commissioner.
Madam Chair, I would move that we approve item 4A as recommended by the county road engineer and as presented on today's agenda.
I will second the motion.
I have a motion and a second for item number 4A as presented on today's agenda. Any other discussion? Seeing none, all those in favor, please signify by saying aye.
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 Aye. Motion passes unanimously. That will take us to item number 4B in the matter of revising Spokane County Traffic Code number 46.44.041 to add load limits to Roberts Road Bridge, bridge number 4103. And I will look to our County Road Engineer, Matt Zeracor, again for our presentation.
Thank you, Madam Chair, and thank you, Ron. Next slide, please. Okay, the last bridge we have to talk about today is Roberts Road Bridge, and this is in the southern part of the county, not far from the town of Latah. You can see here that it's just off Highway 27 and south of Waverly Road. Next slide, please. And it crosses Latah Creek, very near the intersection with Waverly. And this, similar to the other one, during a routine inspection, there were deficiencies found that when the bridge was analyzed, they were determined not to support current legal loads, so we're putting restrictions on it. We've looked at the detour. There are very few homes on this particular roadway, and there are alternate routes to the west in particular. Happy to entertain any questions from the board and send it back to you.
I'm seeing, that there's no other additional questions. So then I will then open up public testimony on item 4B in the matter of revising Spokane County Traffic Code number 46.44.041 that adds load limits to the Roberts Road Bridge. Again, if you want to provide testimony on this item, please utilize the raise hand function on your screen or press *9 if you're on the phone. I will open public testimony. First call for public testimony. Second call, again, raise hand or *9. Seeing none, third and final call for public testimony. With that then, I will close the public testimony and look to my fellow commissioners.
Madam Chair, I would move that we accept the recommendation of the county road engineer in approving item 4B as presented on today's agenda.
I will second the motion.
A motion and a second for item number 4B on today's agenda. Any other discussion? Seeing none, all those in favor, please signify by saying aye.
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 Aye. Motion passes unanimously. Thank you very much. That takes us through our 2 o'clock consent agenda. We will be signing all those documents, and then we will be continuing as we have a couple of additional items that we'll be discussing this afternoon. I believe next up is Jeff McMorris to discuss ARP planning.
Thank you, Commissioner Cooney. Just a couple of quick updates today. You had asked us to dig a bit deeper into the revenue replacement numbers. And Gary Petrovich in the budget office, along with Erica in the grants, Jason Link in the auditor office, and myself met. We went through a lot of the different categories, looked at GFOA best practices nationally, and we concurred on the best funds to include and not include based on the law. I can forward you, Jason Link put together a lot of documents that I can forward to you guys to look at. We forwarded our thoughts to Scott Simmons, who concurred. And so we are very comfortable in our recommendation at it's $9,380,400 to be exact for the 2020 number. And then just a quick update on the 2021 number. Due to the property sale of the racetrack out on the West Plains, that money at this time appears, even though there was debt against the property, we have to put all of the revenue into the general fund, and that could significantly reduce the 2021 number. But we still are very confident that the formula will be bigger than the $10 million flat deduction that we can take. So we are feeling good with that number. Just a couple quick follow-ups from last week. Commissioner French talking about the down payment assistance. I have met with Auditor Dalton, and tomorrow I'll be meeting with SNAP. Vicki Dalton is on the SNAP board, doing a bit more research into down payment assistance options around the affordable housing category. I also met with staff at the city to see what they're doing, just to learn more, to see if it might be an option to combine forces there. They're in the same place we are, looking for a way to meet the rules of ARP, but also accomplish this. So there'll be more information coming in that regard. The project-specific form that you guys looked at last week has been updated. So it's on the website. I think you're all familiar with the community survey link on the ARP page. It's right above that link. So if you guys are meeting with people and you would like to just direct them there, they can put in that information. I've talked with Jared. We will work on getting a press release out and do some social media promotion. So there's just more awareness in the community around that. And I believe we are still on track, unless you guys give different direction, but we're still on track to hopefully pass the first tranche of money by the end of this month. And I think that's all the updates today, unless you guys have some specific questions.
I think for me, Jeff, it's just letting the public know that we're having a meeting with the Southeast Spokane County with the small cities down there on February 17th at 6:30 at the Fairfield Community Center. So if anyone has any thoughts or comments for the South County, that we will be down there talking about ARP, what potential areas it can be used in, so that way we can inform the citizens down there as to what possibilities are. And another question I have is, so on the last revenue
replacement.
Revenue replacement. Thank you. Revenue replacement. So the first calculation you have is for 2021, correct, or 2020?
2020 is the first calculation, the 9.38.
Okay, and then the formula will be used again in 2021, and then 2022. How many years do we have that?
4 years total. So 2020 through 2023. And they impact the up to the 2024 budget.
Okay. Thank you. Because I do think we want to kind of get at least a best guess estimate for what we think that will be going, for those 4 years. So we set that aside.
We do have, at this point, we believe it'll be 30 million, give or take. But that might be reduced a few million because of that property sale that will reduce based on how the formula works.
Okay. Thank you. Any other questions for Jeff and my fellow commissioners or Scott? Okay. Seeing none, thank you, Jeff. Appreciate it. So up next, we have Scott Chesney and Jessica Pilgrim. And I believe this is a executive session. And then I'm just going to check with Scott. So I think we've got this one as an executive session. We've got another one with Ashley Cameron and Josh Grote that is an executive session. Are there any miscellaneous or other items that we would like to discuss, so that way then as we get done with executive session, we can just adjourn for the day? Do either my fellow commissioners or Scott have any other additional miscellaneous or other items?
I just, one miscellaneous, the bill you guys heard yesterday from Mike Burgess on the additional requirements around shelters and all the services provided at shelters, it did not pass out of Ways and Means yesterday, and that was the cutoff. So most likely it is dead this session, and Mike asked me to provide that update to you guys.
Great. Thank you. Appreciate that. Any other miscellaneous items? Scott, I see you're unmuted.
I don't have anything, Commissioner Cooney.
Okay, thank you. Okay, with that, so Scott, Mr. Chesney, can you, I see approximately 15 minutes for your executive session?
That's correct, Commissioner Cooney.
Okay, thank you, Jessica. So 15 minutes for you. And can you state the purpose of the executive session for me, Jessica, and who all you want in that?
Yes, it'll be potential litigation. It'll be Mr. Chesney and myself.
Along with the 3 commissioners in our executive management team?
Yes, ma'am.
Okay, thank you very much. And then Ashley, we have you right after that. And Josh, can you tell me how long you think you want your executive session for and the purpose?
10 minutes, please, for labor negotiation strategy. And it will also include the executive management team, Josh Grote, myself, and Mark McLean, and the commissioners.
Okay, and Mark McLean will be in the previous one as well with Jessica Pilgrim. So I apologize, Ashley, I didn't catch how long.
10 minutes, please.
10 minutes. Okay, so seeing that there are no other miscellaneous items or matters to come before the board, we are going to go into executive session for 25 minutes. 15 minutes will be with Scott Chesney and Jessica Pilgrim joining us, in addition to the 40 county commissioners and our executive management team and Mark McLean. And after 15 minutes, then we will have a second executive session that will be with our 3 commissioners, executive management team, and Josh Grote as well, and Mark McLean. And we will adjourn after those 2 executive sessions for the day, and we will reconvene next week. Thank you all very much.